The benefits of participating in Jefferson Health's Cardiac Rehab Program will help you reach your full physical and emotional potential, as well as improve your quality of life, your self-confidence, and learn the necessary steps to cardiovascular wellness. The staff will work closely with you up to 3 times a week to develop an individualized exercise and educational program to meet your physical and learning needs in a safe, monitored environment. During your rehabilitation, you will be learning how exercise affects your heart, numerous nutritional topics, and a variety of other heart-related subjects such as stress management, the effects of your medication, and cardiac risk factor reduction will be reviewed. The staff will also guide you in identifying the modifications you need to make in your lifestyle to help prevent any further cardiac events, as well as assist you to cope with the emotions you may be experiencing. Your family and friends are always welcome to accompany you. Jefferson Health's Cardiac Rehab Program is designed to help foster behavior change and lifelong healthy habits. Our expert team is ready and waiting to assist you on this journey.
Heart disease is when the function of the heart is not normal. Coronary artery disease, cardiomyopathies, structural heart disease, electrical problems, and risk factors all impact on the creation of a heart disease. Controllable risk factors such as smoking, diabetes, prediabetes, obesity, hyperlipidemia, stress, sedentary lifestyles can all lead to heart disease and plaque development. Plaque develops from the impact of risk factors on the arterial lining of blood vessels. That arterial lining is called endothelial cells. Plaque is the accumulation of cholesterol underneath the lining of blood vessel walls. Plaque comes in 2 types, stable and vulnerable. Once the lining of arteries are impacted, then the development of plaque can occur. First, the lining of the arteries become thicker. Then plaque develops. Plaque starts to intrude on the lumen of an artery. The process can start in utero and continue throughout childhood, and then lead to fulminant plaque once you're an adult. That plaque can many times be vulnerable. Vulnerable plaque is a thin line plaque with a large lipid core. Over time, that thin lining can get sheared away and ultimately break, leading to a heart attack or stroke. Now let's look at the basic principles of stabilizing plaque and your heart. A healthy mindset will go a long way and create the first lining of stability in your plaque. Extreme stress or any stressor to the body can lead to plaque rupture. An appropriate nutritional program, heart-healthy nutritional program, will help to, again, stabilize your plaque and ultimately your heart. Vegetables, fruits, and avoiding saturated fats and refined carbohydrates will all help to change your heart health and your body's mechanics. Exercise is essential towards heart health. It helps to change your metabolism towards a healthy metabolism. It's that healthy metabolism that will lead to heart health. It will continue to stabilize the arterial lining of arteries and ultimately stabilize your plaque. And finally, taking the appropriate medications and supplements will start to lead to, again, a further lining of that plaque and ultimate stability of the artery. This process of stabilization can take anywhere from 3 months to 1 year to completely heal the artery and ultimately the heart.
What are your risk factors for developing heart disease? There are certain personal traits and lifestyle patterns known to increase the risk of developing heart disease. There are 2 types of risk factors, those that can be changed and those that cannot be changed. We're going to briefly talk about those that cannot be changed. Risk factors that cannot be changed are age, gender, race, ethnicity, and heredity. And let's briefly talk about those. Age. As we get older, our risk for heart disease increases. Men are at an increased risk of developing heart disease, but as women reach menopause, they are at equal risk of developing heart disease. Race and ethnicity also play a part in developing risk factors for heart disease. African American, Latinos, and Hispanic populations have a greater risk of high blood pressure, increased weight, and also diabetes, which are risk factors for heart disease. The last one is heredity. If one or more of your relatives have heart disease under the age of 55 for men and under the age of 65 for women, you are at increased risk for developing heart disease. The good news is, though, that there are risk factors that can be controlled.
Now we can look at those risk factors you can change to live a heart-healthy lifestyle to prevent the progression of heart disease. A way to decrease your risk and even progression of heart disease is by making lifestyle changes. Smokers are twice as likely as non-smokers to have a heart attack. Smoking is one habit you should stop immediately. There are smoking cessation classes as well as medications your physician can prescribe to assist you in breaking the habit. Please discuss this with your physician. High blood pressure, also known as hypertension, doubles your risk of heart disease because it makes the heart work harder. Hypertension is known as the silent killer because there are usually no symptoms. This is why it's important to have your blood pressure checked on a regular basis. High cholesterol is the buildup of cholesterol in the walls of your arteries and increases your risk for heart disease. Following a low cholesterol diet may decrease the chances of the cholesterol accumulating in your arteries. There will be more on this topic in a future chapter. Being overweight makes your heart work harder and can lead to the progression of heart disease. Now is the time to watch your diet and begin an exercise program. Those who are physically inactive are at a greater risk for heart disease. To protect your heart, you need at least 30 minutes of moderate activity on most days of the week. Cardiac rehabilitation is the perfect way to begin a safe and monitored exercise program following a cardiac event. More on what cardiac rehab involves will be discussed in a later chapter. How a person manages the stress affects the body in many ways. If you have difficulty coping with stressful situations, you could be putting your heart at risk for heart disease. Cardiac rehabilitation will assist you in developing positive ways of coping with issues and learning stress management. Here in cardiac rehab, you will learn a great deal more about how to modify controllable risk factors, which will decrease your chance of any future cardiac events.
Stress management is an important step in the rainbow of prevention. And there is a very simple yet powerful technique that can help reduce tension in the mind and the body. And the practice is called relaxing sighs. It is using the breath in a particular way to down-regulate the stress response. You may have noticed that when you are stressed, anxious, the breath gets short and shallow. And when you're more relaxed, the breath becomes longer and deeper. Consciously choosing to lengthen and deepen your breath is what can help to reduce the stress response. And this is exactly what we do when we practice relaxing sighs. Now, before we begin the practice, which is simply breathing in through your nose and out through your mouth with a gentle sigh, I'm going to ask you to simply pause and check in and notice your body in this moment. And what I mean by that is to really just notice if you have any areas where you're holding tension. Perhaps the region of the jaw, the back of the neck, shoulders, or abdomen. Just noticing without judging. That is what mindfulness is. Really noticing with a caring, kind attention. And then also notice how the mind is in this moment. There are lots of thoughts, not so many. Is the mind calm? A little agitated? Just simply knowing how it is right now before we begin the practice of relaxing sighs. And now, let's begin. Taking a breath in through the nose and out through the mouth with a gentle sigh. And again, in and out with a gentle sigh. And one more time, In and out with a gentle sigh. And simply pausing again and checking in to the body, areas where you were noticing tension before, seeing if there's any shift, even slight shifts in the body, or any shifts that have taken place in the mind. Breathing in this way, 3 relaxing sighs, has the potential to reduce tension in both the body and the mind. And the more you practice it, the more it can help you. If you are interested in finding out more skills for reducing stress, you can look at the Mindfulness Institute at Jefferson and their mindfulness-based stress reduction programs. You can find this information at the web, www.jefferson.edu/mindfulness. In the meantime, remember to do relaxing sighs anytime, anywhere, and be well.
What you eat is important in the process of stabilizing plaque, but how are you going to know what to eat? Everyone has advice for you. Your best friend tells you not to use butter. Your boss tells you it's okay to use butter, but stay away from margarine. Your aunt tells you not to eat red meat. Everybody eats, so everybody thinks they're experts. At Jefferson Health, we offer a unique, individualized approach. Some patients with coronary artery disease need a mostly plant-based diet. Some will do well with a Mediterranean-style diet. Others may need to minimize their after-meal rises in blood sugar, even in the absence of diabetes. And some need a combination approach. We can help you sort out the best dietary approach and work with you to translate that into what to eat. If you're overweight, losing even 5 to 7% of your body weight can alter your risk factors. That's an easy, achievable goal. We're not saying achieve some pie in the sky ideal weight, 5 to 7% of your current weight. One of the most important factors for all people with coronary artery disease is to eat a more nutrient-dense diet. For way too long, the focus has been on what not to eat, and we aim to change that to a what to eat focus. There are foods that have an anti-inflammatory effect and help protect your blood vessels and lower your LDL cholesterol. Eating several servings a day of vegetables is recommended, and several servings means 5 or more servings, half cup serving cooked, a cup serving raw, as well as a minimum of 4 half-cup servings of legumes a week. So legumes are foods such as black beans, lentils, navy beans, or chickpeas, garbanzo beans. In fact, adding in these types of foods will crowd out the more harmful foods and go a long way toward improving your heart health. Okay, so you say that you don't like beans and you don't like vegetables. It's time to find new and interesting ways to make them, not the ways that we all grew up eating them. Try roasting your vegetables. Almost any solid vegetable can be roasted. So toss the vegetable, things like asparagus, broccoli, cauliflower, carrots, squash, Brussels sprouts. The list goes on and on and on. Toss them in a small amount of olive or canola oil and season it with herbs and spices. In fact, if you put it into a Ziploc bag, add a little bit of oil, shake it up some, and then spread it into a baking sheet. Not a roasting pan. You want the air circulating around the vegetables. Put it in a 400-degree oven. Set your timer for 15 minutes and check the progress. Stir them up a little bit. You can just shake them around with your hand and put them back in the oven for another 10 to 30 minutes, depending on the density of the vegetable. You'll find they're caramelized, they taste sweet, they're good warm, or they're good at room temperature. How you eat will add yet one more layer to that rainbow of prevention.
Exercise is another very important lining in the rainbow of prevention in treating cardiovascular disease. Some of the benefits of exercise include improving your weight, blood pressure, metabolism, your cholesterol levels, your blood sugar levels, your stress and anxiety levels, your energy levels, your sleep, and ultimately your heart and lung function. For patients with cardiovascular disease, when exercising, you want to be in tune with your body's symptoms. While exercising, if you are unable to talk in full sentences because you are so breathless, you may either have to slow down or stop the exercise altogether. In addition, never walk or exercise through chest pain or excessive shortness of breath. Some helpful tips for exercise include not exercising for at least 1 hour after you have eaten, drinking plenty of water so that you are adequately hydrated, avoiding exercising in temperatures that are too hot or too cold, progressing gradually, and pacing yourself. Try to exercise at the same time of day so that it becomes a part of your regular lifestyle. Ideally, you want to exercise at a light to moderate intensity. You can use the Borg Rate of Perceived Exertion Scale to judge your exercise intensity or how hard you feel your body is working while you are exercising. The Borg scale is based on physical sensations that you feel when performing physical activity, such as increased heart rate, breathing rate, increased muscle fatigue, and increased sweating. Generally, working between an 11 to 14 on the Borg scale is a good exercise effort. This is a fairly light to moderate intensity of exercise. By self-monitoring how hard your body is working by using the Borg scale, you can adjust your intensity of activity by either speeding up or slowing down your movements. The talk test is also a good way to gauge exercise intensity. If you are having trouble talking while you're exercising, it is likely too much and you need to slow down or either stop the exercise. When starting to exercise on your own at home, remember to start slowly and gradually progress your frequency, intensity, and time of your exercise. Simply starting to walk is the first step in our Cardiac Rehabilitation Program. Walking is one of the best aerobic or endurance exercises that you can do when you have heart disease. Walking is easy to do, is safe, inexpensive, practical, and requires no equipment except a comfortable, properly fitting pair of sneakers or flat shoes with laces and comfortable loose-fitting clothing. You can begin a home walking program by exercising for a brief period of 10 to 15 minutes several times per day. Once you start to feel stronger, you can walk for longer periods of time and less frequently throughout your day until you reach a goal of about 30 minutes of continuous walking per day. 30 minutes would be your goal. Remember, in terms of how hard the walking exercise should be, if you can't talk or catch your breath, please slow down or stop the exercise. The most important thing is to just get out there and walk. Just get started. Record your walking activity in a walking logbook. You can write down the distance that you walked, the length of time it took you, and any sensations that you felt so that you can track your progress. When your doctor feels you are medically ready, he or she may recommend outpatient cardiac rehabilitation. When you participate in this program, you will be put on a cardiac telemetry monitor while you are exercising so that your heart rate and your rhythm can be observed while you are exercising for any abnormalities or changes. In cardiac rehab, you may perform exercises on a treadmill, a stationary or recumbent bicycle, an elliptical machine, a rowing machine, or an arm bicycle ergometer. In addition, you will also perform resistance exercises such as free weights or resistance bands in order to help strengthen your arms and your legs. The intensity of the exercise in cardiac rehab will be determined by your Borg rate of perceived exertion, your target heart rate, and other vital signs. Remember, exercise is an excellent way to help stabilize vulnerable plaque and to add a protective layer to the rainbow of prevention for a healthy heart.
Once you have mastered stress management, the appropriate nutritional program, exercise programs, and taking your medications and supplements, you will go a long way towards creating the rainbow of prevention. It's that rainbow of prevention that is essential. You turn a vulnerable plaque into a non-vulnerable plaque, one that is stable. It is that stable plaque that just won't rupture. You are beginning the process towards heart health and ultimately plaque stability. So call Jefferson Health now to schedule Jefferson Health's cardiac rehab today. It'll be the healthiest choice of your life.